Ever wondered why erectile dysfunction is more prevalent than we'd like to admit? Could a system of medicine dating back thousands of years hold the key to a holistic approach to its treatment? If you're thinking of Ayurveda, you're right on the money. The first step in Ayurvedic treatment for erectile dysfunction, or ED, is often the introduction of herbal supplements. Among these are ashwagandha, known for its rejuvenating properties that help reduce stress and anxiety, and shilajit, a mineral-rich substance believed to enhance sexual vitality. Other herbs like gokshura and safed musli are also used for their aphrodisiac properties and potential to improve sexual performance. But Ayurveda isn't just about supplements. It's a system that emphasizes balance in all aspects of life. A balanced, nutritious diet is key, filled with fresh fruits, vegetables, nuts, and seeds. Regular exercise and yoga can also work wonders, improving blood circulation and reducing stress, both of which can contribute to better sexual function. Then, there's the calming and therapeutic practice of Abhyanga, an Ayurvedic oil massage. This isn't your run-of-the-mill massage. It's a ritual that promotes relaxation, reduces stress, and improves blood flow, all of which are essential for sexual health. If necessary, an Ayurvedic practitioner might recommend Panchakarma, a detoxification therapy designed to remove toxins from the body and restore balance. And of course, there are Ayurvedic medicines, formulations or combinations of herbs and minerals tailored to an individual's constitution and imbalances. Finally, Ayurveda pays special attention to stress management. Techniques like meditation and deep breathing are often introduced to help manage stress, a significant factor in sexual health issues. In summary, Ayurveda offers a comprehensive approach to the treatment of erectile dysfunction. From herbal supplements to diet and lifestyle changes, massage therapies, detoxification, medicinal herbs, and stress management, the Ayurvedic approach addresses the root causes of ED and aims to improve overall health. This way, it offers sustainable improvements in sexual function over time. Remember, it's crucial to consult a healthcare professional before starting any Ayurvedic treatment, especially if you have underlying health conditions or are taking other medications. So, could Ayurveda be the holistic approach to ED treatment we've been looking for? It's worth exploring.